I work very hard with all the employees, with all the physicians, with the volunteers, with our patient family advisory councils. And I say that because it takes a team. Healthcare is a team sport. And the nurses are very important. My mom's a nurse at age 89. She's still a licensed nurse in Massachusetts. 2 sisters are nurses. I grew up surrounded by nurses. They're a vital element of the healthcare team, but they're one component of a team. So we have, at Health Alliance, I think I established over a number of years a very healthy relationship with the M&A, specific to the M&A. We had our differences, but we always found a way to resolve whatever issue is at hand. I hope that I'm able to accomplish that here. Probably doesn't happen in year 1, but hopefully in year 2, as we get to know each other better, maybe those relationships improve. I would say definitely the former, so increasing access. So people look at healthcare reform in Massachusetts and they say, well, that's really Obamacare. People forget that we started this in 2006. We had healthcare reform, universal access in 2006. As the years go by, I think it was 2012, we then decided how we were going to finance healthcare reform, and that's Chapter 224 that the legislature and the governor signed.
Cost containment. Cost
containment. How do we pay for 98% of the population to have insurance? How do we control the growth in total medical expense? The Health Policy Commission was created out of Chapter 224, which is at the center of mergers and consolidations right now. So all of that was created many years before President Obama's healthcare reform legislation was approved and finally executed. But it has been the president's plan kind of layered on top of what we know as healthcare reform here in Massachusetts that has really improved access, and it has improved the funding. It has extended Medicaid, the privilege of Medicaid coverage to a much broader population. And that population would usually end up in our free care or our bad debt expense. And now we're getting at least some reimbursement, Medicaid reimbursement or Medicaid managed care reimbursement for those patients. Significantly under what it costs us, but far better than free care and bad debt. So, Patrick as an individual is very pro healthcare reform, is very pro what President Obama has in this state kind of laid on as additional access for people that wouldn't have access to healthcare. And I think those are both great components of a strategy for healthcare delivery.